The Germans have always said, Kissinger and all the Germans said, treat the terrain. Don't worry about the virus, the bacteria, this. Balance the terrain. That's what acupuncture is about. The problem is, how do you get this balancing system into a hospital setting? I'm going to tell you how. You do it through what we call scientific prayer. That's what we called it. We put the codes on the body, over the telephone. It can be done over distance. Prayer works. However you want to look at prayer, many of you have different religious backgrounds, but there is a theory called the string theory. The LA Times just did an article on Strohenmeyer on, it's called A Career Boldly Tied to Strings. And I'm going to read to you what this, just a short synopsis of what this is, because this is the basis of many of our healing techniques, and it's brilliant. String theory brought together for the first time physics and math to a common ground. The physicists said the world and universe is made up of waves. The mathematicians say no, it's made up of numerical theorems and numbers. The string theory says the universe is made up of coiled pieces of numerical data on physical coils. Going back to that monk in Italy, but let me just read you what the string theory says. According to string theory, the fundamental building blocks of the universe are not particles or forces, but tiny loops that vibrate on 10 dimensions. Just as a 4-string violin creates symphonies of sound, the harmonics of these higher dimensional strings create everything in the universe. This is physicist Andrew Strominger from UC Santa Barbara. Now what this means is that what we are doing is resonating the strings. Now what is a string in our human body? Anyone give me an answer? DNA. Double helix string. If you can resonate and balance it, I always said that was a fiber optic system. If you can resonate that and bring light into that system, whatever means you use, or information, then you're going to get the balance and the healing. This is the basis to this system. The engineer did not understand this. Now, one of the things that I want to say to Ed is that if it wasn't for Ed Carroll and the Academy putting this together, many of us would not have the levels of information and knowledge to take care of certain people. I was called in on a case about a year and a half ago of a very famous actor. Did anyone recognize this man? This is dedicated to Ed, the Academy, and Carol. You know who he is? He's a bad guy. Steven Seagal. Steven went up to Alaska to film this film called On Higher Deadly Ground. I think it's Higher Ground, Deadly Ground. And he put his life on the line because at the end of that film, he talked about the 7 sisters, the oil companies, and the massive contamination they did in the world. He told me, he said, people don't realize that by saying that phrase there, he could have been killed. If he didn't have certain people backing him to protect him, he put his life on the line to make that statement in his film. And what happened while he was up in Alaska, he did a full mouth reconstruction with one of the best dentists in Alaska there. A $50,000 case he paid. And in the process, he almost died. I had a cardiologist friend of mine call me up and said, listen, if you don't get in this case, he's going to die. They prepped his upper teeth, putting crowns in there. No dental material compatibility testing. This man is psychic, is sensitive, can sense a being, a person 100 yards away. I've seen him smell cigarette smoke. You know, in Vietnam, in the war in the jungles back there, you smell one cigarette, you smell it for 200 yards away when you're tuned in. And they put dental work in his mouth and it almost killed him. 5 teeth they prepped, 3 of them almost ended up in root canals. Using this engineer's system of healing, we were able to take acute pulpal inflammatory reactions that were ready to go into endo and save his teeth, save his life. From that process, I mean, he has told Ed and the Academy, thank you. Because if it wasn't for the knowledge of some of the people that we all have out there, and this man will support alternative healing in medicine to the nth degree, okay? And there are others out there in the entertainment field that will do this for us. I was talking to George Mining, how can we get the system to change? Many times we can't get it to change to the scientific community. They're too entrenched. But maybe we can get them to change through the entertainment community. One of the things on my dossiers that I was able to read, and Carol showed this to me, is as we won our battles and we help other people fight their battles, I read the dossier on myself. It was like getting your Freedom of Information Act on you, you know, looking at what the other side says about you. And they said to me, well, we had to let Dr. Harada, this is Attorney General now, we had to let Dr. Harada go because we ran out of money. There was lack of funds. They didn't really tell the real, it's like, don't believe what you read. They didn't really say why they had to let me go. And we've discussed with some members of the people here that are in trouble. And I told you about the fact that many of you shouldn't be without assets, please. Because then you could, if you are hit, you do not get compromised economically. Anyway, what I want to go into now is the fact that this string theory system can be utilized in acute situations. I want to leave, we talked about setting up a course or a workshop. And at the next academy meeting or something like that, I would like any of those that are interested in this, learning this system that is not dependent on high tech, a pencil or pen and paper is all you need. Dr. Reby submitted his data to the Nobel Prize Committee via Switzerland to Sweden before he died. He died a month later after I saw him, okay? But he was completely healthy when he died. Completely healthy in 30 days. He just said to a woman, that he said, it was 3 in the morning, he talked to her for 7 hours, till 3 in the morning, he says, excuse me, I'm a little tired right now, I need to go talk to God. He said, do you mind if I can be excused? She said, no, please go. And then at 6 in the morning, he passed over. I learned a lot from this, because what I learned is that many of us are passed down certain levels of knowledge. We don't know why we chose this path, but this path was given to us for certain reasons, and because we're here, because we here believe that what we are learning is the truth. And this is why I think all of us are committed to this. So I want to share something. I've always said that if you can learn one technique at a seminar, one valuable technique that would save one person's life, and how many of us dentists ever considered we would save people's lives? You know, we're thinking we're going to fill bridges and do good class 5 foils, you know, and stuff like that. But to save a human life is something that's so precious and valuable. And I said that if we can learn one technique, it's worth many of you, losing what, $5,000, $10,000, $15,000 out of your practice time. So I'm going to share with you one aspect of Dr. Reby's string code theory, that he felt that if you use this particular coding system, you'd protect yourself against cancer, AIDS, and tuberculosis. I'm going to give you a coding number here. This is 50 years of work, and it looks so simple. I've always said in martial arts, what looks simple is always the most complex. Okay. First, I'm going to write an 800 number down here. 800-227-1504 is a beeper number that I carry. It's a beeper number that I carry, 800-227-1504. And if I heard, for example, I met Christine Jackson. Is she here? Did she leave already? Christine had a heart attack about a month ago. About 3 or 4 months ago, I think, and she said September. She almost died twice. Almost died. Here's an amazing one who fought to get Sonam remedies in this. I remember the first days when they were bringing him in sneaking him over here, and put him in little closets and things like that. And she almost dies from a heart attack. And I had Dr. Cowden. Many people were helping, and Dr. Lee Cowden worked on her yesterday. And many of us have to work on each other, because there's no one else that understands what we're going through. But she spent, I can't remember how much. Ed spent over $200,000 in medical bills. Thank God he was in a trust at the time 3 years before, because we set this up for the doctors, and they couldn't take his house and everything and completely. We did it for another reason. We did it to protect him against establishment, but it was his health that almost created the problems. So what I'm saying is this 800, if any of you have a situation where there's a key person in our community, Ram Das, for example, I don't know if you know him, just had a stroke about 2 weeks ago. And within 2 days, he was in a stroke, 7 days, could only move his eyes like this to just communicate. Within 2 days of doing this healing system, he was able to talk. If we could have accessed Ed, I had a patient who had a stroke who had no more than 12 hours to live. Both her and another patient's mother had a bacterial infection of the pancreas. less than 12 hours to live. Both on the same day came in. The immediate application of the healing system in a little bit more sophisticated fashion or evolved system than what I'm going to share with you. But within 1 to 2 to 3 hours, they both were sitting up and talking to the doctors. And within 7 to 10 days, walked out of the hospital on their own, free of infection. I've tested this system now. I'm sorry that I did not present it maybe a year or 2 years ago, because maybe some of us wouldn't have had to go through some of the things we went through. But this system I reserve for those individuals who are in life and death situations. I've never not seen it not work, unless the person wants to go over to the other side. And Carol asked Ed, do you want to stay or do you want to go? If you want to go, it's okay. And Ed said, I want to stay. And because Ed said he wanted to stay, you're here today in this meeting. That's how powerful Ed's decision to stay was here. So let me give you these codes. Let me give you these codes because this is a gem. This is 50 years of a man's life that he dedicated. These codes, the numbers 32, 34, 36, and 44. These codes, if they're placed on your energy field, will balance your energetic field. You have to be not wearing any jewelry, rings, belts, anything that constitutes a loop, because this is the balancing system for the human body. You can put it on a photograph, like this. I have this on Stephen's photograph right here. Of yourself, your children, or anyone. Just put on your photograph. If you just write the numbers, yes, just write the numbers. That particular code is a basic balancing code for the immune system. Now, I'll tell you something. I've been coding myself for the last 4 years. There's a special research project that I took Ed to and Norma. And Norma, who has been really a help in the academy, had a recurrence of ovarian cancer. And she had really, it was not a good situation. And what happened was that we all went, and there's a researcher down at UCLA that does a natural killer cell test. Natural killer cell test to mark in the body. It's a great test. He does it for free, by the way. If any, his name is, and let's see, is Dr. what? Gonium, Dr. Gonium, G-H-O-N-E-U-M. He's at the Hawkins Medical Center in I think it's South Central LA. It's part of the research wing for UCLA. He tests natural compounds via the natural killer cell test. He takes a natural killer cell test for free. If you resonate in the range, normal is about 50. If you resonate below that, he will put you on the test, and he will give you natural compounds from all over the world to help raise the immune system, and for free. Okay, wonderful program. It's funded by some of the nutrition companies and some of the companies that really believe that their compounds work. It's a wonderful test. Anyway, Ed took the test, Carol, a lot of us took the test, but I never did because I was too busy working on patients. So finally, he said, Dr. Godin said, hey, you take the test. I said, okay. I took the test. I had one of the highest natural killer cell readings. I had 83. So obviously, something that I have, he said, what are you doing? I said, well, I don't have time to do anything. I said, if I told you what I was doing, you wouldn't believe me. Because he's kind of a straight researcher. So, I mean, that was valid proof to me that my immune system was working at a higher level than most people. So obviously I was doing something right. Now this particular coding system works only if you do not have, women that are wearing bras, for example, you have a little ring on the bras, it doesn't work. It throws the balance energy. If you wear eyeglasses, round eyeglasses, so if you can wear some of these glasses like this that are square, because it has to do with the string theory of balance. Resonating string theories of balance. So this particular system, at this level, what he would do is he'd put patients on the numbers. And they work on animals. I've even coded my computer, my beeper pager, my cellular phones, because of radiant resonant energy. I've coded myself at the seminar here from flying on airplanes because we get radiation. Okay, you can do it to self-treat yourself. I really want this system because if I was going to go in the jungle or somewhere, how do I treat myself? I was flying an airplane back from Switzerland. And I forgot that at that time, everyone still smokes on those airplanes. And here in the United States, we banned smoking, but on the European flights, my God, you die. I was in first class and I was dying. I mean, it I mean, I'd smoke coming in, it'd kill me. On the way back, I said, oh my God, I'm not going to make a 12-hour flight again. I just remembered how bad, I'm not going to live. I can't handle it. I got so desperate, and this is why desperation always is a creator of genius in the mind. I got so desperate that I figured out a code pattern. This particular code pattern was, I believe, 28 and 32. 28 and 32, 28, 32. Yeah, those are the two codes. Plus this one, these four here. And I didn't have paper to even put it on. I didn't have a photograph. I had a pen, and I wrote it on my skin, on my forearm. And within 2 minutes, I could breathe, and I was not bothered by the cigarette smoke. That was my proof to myself. My proof coming back, before I even went to Switzerland, I had a doctor friend, physician friend, who actually, her sister was in a coma for a year. She was a physician, and she said, do you think you can help my sister? I said, well, what do you got to lose? That's always what I say to someone who's dying. What do you have to lose? So then at that point, we coded her sister, and then I went off to Switzerland. And I came back, and it was a month or 2 months later. I said, by the way, how's Chobi? And she said, it was a miracle. I said, well, what was a miracle? She said, Chobi was in a coma for a year. Her sister would not allow any of the nurses to administer insulin. She was insulin-dependent diabetic, adult diabetic. She would not allow anyone to administer insulin. So she would administer it every day for a year, go down and spend it with her sister and give her acupuncture and whatnot. She's in a coma. And after the codes went on, within a week's time, the sister's blood sugar level reads went almost down to normal within a week. And she came out of her coma to acknowledge her sister for a period of time. I mean, it was incredible. And I didn't know about this till a month or 2 months later. So here was a case where you can't say it's like a classic, how you say, like treating animals. They're not conscious. And it worked. And I've seen this work countlessly now. And I'm sharing this now with the group because if, by any chance, that there is a situation of a life and death situation, then maybe this system could help. And if those of you that are interested in learning this system at some point down the line, through the academy, through Ed and Carol, whatnot, maybe we can set up a seminar. I know we're talking about, what is your name again? Ara. Ara is also going to possibly give us a workshop seminar because I loved his work. It was just beautiful. It's just this brilliance that comes about because out of necessity, right?
Out of grace.
Out of grace. Yes. Dr. Reeby, let me say something to you. A Swiss healer friend of mine channeled him a month or 2 months afterwards, and I realized his spirit was with me in sharing this. I don't take credit for this, by the way. I did a lot of work for 4 years in bringing us to this point, but it was his spirit and others, I'm sure, on a spiritual level that brought this forth. If you believe in God, I don't know, but I've had some experience that verify God exists. So what I'm saying to you is that what Reeby did and what we are trying to do right now in this situation is to be able to go ahead. He said to me, do not forget, my dear beloved son, he said that to me. He said, do not forget to ask yourself what gives you fulfillment, what gives you excitement, what gives you pleasure, and what gives you grace. That's what he gave back to me. And he said, you are doing beautiful work, and I applaud you for what you are doing. But I knew that his spirit was with me, even though he went over to the other side. So this particular technique, like I said, you can get it into any hospital in the country. I've never seen it being rejected yet. I've never seen it because prayer, they cannot. I've even got a minister's license. So I mean, on that level, you know, there was a good friend of ours that Ed knew who is an orthodontist by the name of Dr. Izzy Ember, who passed away maybe about 4 or 5 years ago. Many of you maybe know him. Wonderful soul. And he got his minister's license so he can do craniosacral work, so he can lay hands on. Understand? We have to find techniques now where we could.
I have a few of them. I got a few of them.
Okay, we need to find techniques in which we can use all the modalities at different times. They all work in some certain situations. But there are times when life and death situations occur that we need to be able to find techniques where we can get into the hospital and help someone. Especially some of the older members here and the younger members here that are so critical to this movement. I'm hearing things going on, and I'm saying to my God, they don't have to suffer. They don't have to go through. Maybe they do karmically, but there are ways of shifting karma. So these are numbers. This is my 800 number. I have a voicemail if you need to leave a message, and also I'm going to leave a little thing here, and we can go ahead. If any of you want to sign up, leave your name and phone number, address, and Carol and Ed, they'll contact you at the academy or something like that. I'll leave a voicemail also. And then the voicemail is 818-889-1905 if anyone needs to leave a message. Are there any short questions that I know I took too much time already, but anyone have a question on this system right here? Yes.
Yeah. Question was, let's say you put the numbers on the person's phone.
Yes.
Phone distance. Does that person have to be without the loops?
Yes. Particularly, especially if the loops are to work, if the Swiss string codes are to work in this particular dimension. I have another dimension that's more highly evolved. It is not dependent on form field, but this is dependent on form field.
That's more ethereal.
Yes.
Okay.
This is dependent on. So if you wear a loop chain, a necktie, this system doesn't work. But at least when you sleep at nighttime, try to take off all rings, all jewelry, and your glasses. Okay, and women wearing bras, have someone that just cut the little rings off bras and just sew the bras together if they need to wear a bra when they sleep at nighttime. This will, if any of you do pulse, this is how I believe. I was so busy at the time that this one person introduced me. I said, I don't have time to learn this. But my acupuncture background, this is the layer of knowledge that we all are gaining. You can't buy this. It's layering. That acupuncture knowledge that I had of pulse diagnosis, when all of a sudden I put these codes on to the body and tested the pulses, all of a sudden the pulses are balanced. And my greatest fear was needles as a child. That's why I became a dentist over going to law school or medical school. I had to overcome that fear. I said, my God, needleless acupuncture. This is what we're trying to do when we do the homeopathic. We balance with a Vaughn machine, or we do needles into the body or whatnot. We're trying to get the terrain to balance. I set patients on a balancing energy terrain 5 to 7 days before surgery. In the olden days, I used to use nutrition, homeopathy, getting the patient ready to get them into the anabolic state so you can do the surgeries. I just put them on because to balance them out before, if it helps to make sure they're not in a geopathic stress zone. I've used this technique to put a person on balance over the telephone and find the geopathic stress zone by putting them in balance, like Vaughn used to do. Let's put you in balance first and then bring a compound on the challenge in the circuit. If the circuit goes off, you know that's a bad compound. That's the original dental material test, and material test for supplements was done that way by Vaughn. So you can put the person on balance with this system and then take them and lay them down on the bed and see if they're in a geopathic stress zone over distance.
Loops? Wristwatch?
Wristwatch is a loop. Your glasses are a loop. If you can get a glass that does not have anything, but they have these little plastic little nylon strings that cover the glasses, glasses are a loop. That's why I had to evolve it to another level, because most people wear glasses or something like that. Yes?
Leather belt also?
Leather belt's a loop. I even had a person with a Reebok shoes with the O's on the Reebok. That, you know, if the O's work on the picture, they work on your body field. Okay? So, I mean, the O's. I had a person, she came in with hardly no clothes, just a little, you know, a halter and shorts and tennis shoes, and I put these numbers on. I couldn't get her to balance. Looked all over for a loop, couldn't find one. On the bottom of her shoe was a little plastic embedded O-ring, like O-ring in her shoe. That threw it off. Okay? You might get, yes?
Is it the picture or the picture and the individual that's in the picture both have to be free?
You know, I've tested that out too, and I found out that the picture, if they have a loop, and I used to have people when they take pictures, you know, strip down to a T-shirt and maybe some underpants or something like that. Yes, so you can test that out. You can muscle test them if many of you muscle test. A lot of this can be done by muscle testing. And when we go into the core seminar, I'll show you actually how expanded. The first life that this system saved, by the way, a week after I got back from Switzerland, was the life of a cat who had a viral infection of the heart. A great homeopathic physician, veterinarian down in Southern California, tried everything he could do with homeopathy and couldn't save this cat's life. Of course, this friend of mine came in on Sunday and said, do you think we can save Keisha's life? I said, what do you have to lose? That's always my phrase. What do you have to lose? Let's try it. This cat was so weak that it couldn't even get a litter box. It couldn't even urinate or whatnot. And we did the code Sunday night. By Monday afternoon, that cat was bounding out in the yard, peeing and jumping around, and went on to live. That was the first life that was saved and this system has saved quite a few lives since that point in time. Yes.
Do you use the coils anymore?
No, I don't. I don't use the code. It was a transition. And so Reby also, after one point at 91, went from putting the bracelet coils on to going to the numerical situation. Yes.
Can you repeat the name of the scientist, the physicist who
Yes.
quoted it?
Yes. His name is Andrew Strominger, Strominger, UC Santa Barbara. I have the LA Times article. It's a wonderful article because what he does is he brings string theory with black holes, and really this is the cutting edge of the new physics. So what this system is, I'm going to meet him sometime and say, listen, your new physics actually can heal. You actually can heal. And this can be, but it can be explained. It was the first time that physics and math came to a common ground. It was a beautiful theory. And it's all based on our living system. Anything? Yes?
Is there a set code for cavitations, or is it very...
There is certain code numbers for cavitations, for infections, and I'll give you those right there. You can use this particular code pattern and add 57 and 75 and 58 and 85. Those are infection codes. Those are bacterial infection codes, lymphatic codes, and has to do with basically preventing reinfection of the socket site.
Does it matter the order?
No, it doesn't matter on the order.
So you would place your original numbers, the 30, 33, or 32, 34, 36, 44, plus those?
Yes.
You get two different pieces of paper?
No, on the same. You can just add them right beneath here. Right beneath there. The best way to do is muscle test the patient. Okay, muscle test the patient. These are, I'm giving you kind of a primary system, but this primary system took 50 years of evolution to get to this point. So I'm sharing this with you. You got a gem here that was worth your trip here. Yes, this man did do a lot of work with cancer, but there's so many more issues to cancer than just, one of the things you have to ask the patient is the will to live. Do they want to live? That's the most important issue. And you can bring the will to live energies up with this system. Yes, we've done it. Yes.
Did it have to be in a certain spatial order, it has to be vertical?
I don't think so. I don't think so. In fact, when I asked Reby on this, he gave some techniques. Any of you that have children or something like that they want to have children for fertility situations, he used the number 109.
So sometimes 3 digits.
Sometimes 3 digits. Yes. Yeah, and then it would help bring in a healthy child. 109. And then the rest you're going to have to come to the course and help the academy out.
Well, I understand. Now, are you just writing these numbers and just laying them, say?
You could put them physically on the body.
For how long?
These particular 4 numbers you can leave on indefinitely. But the other numbers usually will resonate for only 12 to 24 hours, and they have to be shifted because the body, like everything, is in a cycle. So we shift into a different cycle every 12. Anyone who do magnet therapies know this too, that you can't leave magnets on for any long length of time because the body goes through a positive to a negative polar or anabolic to catabolic. A healthy body should go through these ranges. So that
You're saying shifting, rearranging the numbers?
you have to set a new code on. But this is a universal code here. This is a universal protection code for immunity that can be left on. Hopefully each of you could also be in a non-geopathic zone, because most of us know that in the degenerative healing work, if we put a person in a geopathic stress zone, their healing response is retarded. Surgery, what's his name? Dr. Turk used to always at his hospital, he'd always check the beds. Yeah, patients come in from all over the country to do surgery. I talked to a physician from Mexico here that does work, and patients go back home. And so they put him on antibiotics. Well, the Germans said, try to stay away from antibiotics and drugs because it can impair the healing process and reinfect the infection site, especially if they're reactive to the chemical compounds, because it stops and blocks the healing process. So this system is totally non-drug oriented. I've never had a proving type of reaction on this like I had on homeopathy, where it brings up the infection. I've had a case, I'll share this with you, and this was authenticated by the orthodontist friend, and his brother got hit fooling around on Christmas Day and got hit and got a vertical fracture of the tooth halfway down. Anyone who's dentist knows, and the tooth avulsed, and the nerve was actually pulled down from part of the tooth stayed up, the root tip stayed up here, and the rest of the tooth came down central. We pushed the tooth back up there. They got some nylon. We did it over the phone, got some nylon. They pushed the tooth up in the socket. Any of you know that a vertical or horizontal fracture of that nature is impossible? I mean, there's nothing you can do on that. It's not. You got to take the tooth out. At least in a tooth that's completely avulsed, you can push it back and do an endo on there maybe, which we don't believe in endos anymore. We pushed the tooth back up. We coated it immediately, coated it for the next week. It's now been 2 years. We just put a little composite bonding to interproximally hold the tooth in position. That tooth is still vital, has not changed color. You can still see the vertical fracture there and functioning 2 years later. I mean, that's in dentistry. I mean, the dentist, that's impossible. That's impossible to do. Like, I have to cut because what I'll do is we got to go on. I just had to share this with you because it's so important, and I didn't want anyone here that knows if someone in our field endeavor that's so important to our movement. I don't want them to leave like Ed almost left. That's why I'm up here and I'm laying it on the line for you today. Yes, one last question.
I just was curious about the 6. It looks like a loop. Do you have to draw it differently, or it doesn't matter on the 6?
No, it doesn't. It doesn't matter. It doesn't matter. It doesn't matter. And I'd like to eventually, what we're going to do is we're going to get funding to set this up so we can actually do a research project where we can do a, let's say, take diabetics that are on insulin, for example, because they monitor themselves every day. That'd be a great test because they'd work very well on diabetic cases. He did some wonderful work in that area. But it seemed to work on every specific case that we are able to do. I've never seen it not work. That's the most amazing thing. And I have looked around the world. Many of you know me. I've searched for every type of healing technique that I could. And this does not interfere with acupuncture or any other techniques that you do also. And I've done it for surgeries when people are going under general anesthesia, by the way, and I was listening to Chris doing his work there, to protect people under general anesthesia while they are being administered chemicals. And they're also spiritually open during that time frame. I'm more concerned about sometimes the spiritual body now than I am the physical. You know, I think Jesus said that somewhere. You know, don't worry about the physical, don't worry about that. Worry about the spirit. One question.
I'd like to ask you, is the concept of the loop, is it continuous, like your trousers form a loop around your body?
A continuous loop, like a loop that's in your, like your shorts or something like that. That's part of it. No, that does not constitute. But interesting enough, the Levi belt buckle. You know, the Levi's, you wear jeans. I see Chris wear jeans. I'm wearing jeans. That belt snap has an internal loop in there. And so in my olden days when I used to do this original technique and I wanted to wear jeans, I'd pop out and put just a regular button on my jeans because the Levi belt thing knocked off this balancing. But you can test it. All you guys muscle test or EAV test. We took a patient who did a Computronics unit and had a focus down here, down in the third molar, and I just wrote the codes out for the focus.
Where would you write the codes on their body? Or
You can put it on the body. You can put it on, that person was connected to the EAV suit, look, it was a Computronics unit, and just put it on the energy circuit of the person or on the photograph. This person went back and checked it on EAV. She couldn't find the focus. She said, I can't even do that with homeopathics to get that kind of balance. She said, how did you do that? So, I mean, I've had it tested now through different systems. Yes, Arv?
One question.
You're coming up next year, so.
Well, I've always had problems since the 70s to do muscle testing.
Yes.
You think because whoever I was testing has a loop on? Because I have asked my friends, I just cannot do it all the time.
No.
Do you think it affects my muscle testing?
What
If
does?
somebody has a loop on his body.
No, you may be, there may be something within you that's preventing you. They call it black man.
I don't feel prevention. I have other
Systems to do it with. It may be just a block. There's something that you have that's blocking you from receiving that information, whatever it is. You may, like I said, maybe we can test it out later and we'll find out. I'll work with you on that. You want to find out? I'll help you find out. Yes, Dave.
On your series of numbers, are they all double-digit numbers, or do you?
No, single-digit numbers are actually, this has to do with the body-level energies. These codes go into the mid-body. It covers basically key organs. Throat, liver, gallbladder, spleen, pancreas. And there's even a code for heavy metals in there too, by the way. So metals on the body, he found out very interesting. Metals on the body, when he did this work, did not work with this system. He found all metal. In fact, he used to use copper coil wires before, and after he found the patient become reactive to copper, he had to find something that was not metal. So it falls right in line with our work here with non-metal restoration, things like that, that metals interfere with the energy fields. I've done coding work on hip replacements to get the inflammatory reaction down, but you have to understand something. A lot of that is a natural rejection. The body's actually intelligent, is telling you what it wants to do. It wants to get rid of it. So yes, you can bring the body into balance. This system still does not, you still have to go for the etiology of the problem. It was really great because I heard this talk about palliative medicine versus etiologic. I like etiologic medicine. I like that phrase. Etiologic medicine means we're going for the cause, not just covering and band-aiding or this or that. This system can bring the body, it balances the terrain. If you have a thing that's irritating or bodily terrain like an implant, you still got to deal with that. But I'll tell you one area this works brilliantly on is depression. Young kids, old people. I can take a depressed case, a suicidal case, within 12 to 24 hours, they're out of it. It takes about 2 or 3 days to get the person into balance, but it works. I've never seen it not work. And there's a rational explanation for us, but it gets also into areas where, like I said, this is where the workshop will go. Has that whetted your appetite enough? Okay. What's the number for depression? You're going to have to come to the workshop for that. Good. Well, try it on your surgery. I'm telling you. Tomorrow?
Do the same thing before they do the IV.
Yeah.
That's terrific.
Yeah, and I share some stuff with you on the
Pray
IV.
when you do that?
Yeah, it actually is prayer. It's scientific prayer. That's why I wasn't kidding when I said it's scientific prayer. That is what it is.
Explains quantum physics to me.
Exactly. This is what it is. It is quantum physics. It actually beyond quantum. They say in the article here that it explains what quantum physics can't explain. The string theory is able to explain. It goes beyond quantum physics. Quantum physics. Quantum physics has to do with molecules. This goes into actually the energetic realm, explaining how the universe is formulated. It's
Mind-boggling.
Yeah,
Thank you very much.
You're welcome.
You know, I just want to thank Dr. Harada. He's one of the founding fathers of the Institute here, and a mentor to all of us, and he's been into this stuff longer than probably all of us put together, and probably many lifespans before. But I appreciate his time and talent and his words of wisdom, and I'm sure you all do too. Why don't we take just a 5-minute break, okay? 5 minutes. Go drain your dragons and come on back.